period of this order. And then paragraph 5, an immediate danger to the public health, safety, and welfare of the people of the Panhandle Health District requires the imposition of this emergency order. From the information that we have received, that Jeff has provided, and we've seen news reports nationwide, worldwide, there has been a precipitous drop in the number of new cases, and the immediate threat to our public health and safety is no longer there. For that reason, I would definitely support rescinding this order.
Thank you, Glenn. We'll go through the list. Tim, do you have any comments on this motion?
No, I don't.
All right. Jay, do you have any comments that you wish to share on this regarding this motion?
Yes, I do, Chairman. Thank you. I think it's premature to rescind the mask mandate with the information Jeff just presented, with the challenge of the new variants that are out. I do agree there's been some positive steps, and I think everyone at Panhandle for the vaccine campaign and rollout and making this trend line move a little more in the positive direction. But I think we need to continue to follow the science and the data. And right now, I think we're in a bit of a gray area. There is a rise of COVID in 20 and 30-year-olds right now. You know, we just haven't docked the boat yet. We're very close, but we're not there yet. And I think when we, continue to use caution in our communities, we will reduce the potential for even more aggressive variants. And so it's a paradox, but I think again it's important right now to stay on task and keep that mandate for another month, which is what our last decision in January was, and continue to monitor this and see how it goes. All the counties are still in the yellow, and listening to Jeff's cases per thousand, we're kind of on the high side of that, on the low side. Again, the virus rates are dropping, but I do have concerns about the new variant. I know this pandemic, we're all tired of it. We have fatigue. I understand that. This has come, these decisions have come at a high cost for all of us who have supported the mask mandate and the director and staff at Panhandle. But again, I think we need to follow our gating protocols that we adopted and continue to follow the science and the data, which tells me right now it's a little too soon.
Thank you. I'm going to call on Mike from Shoshone County. Mike, do you have any comments on this motion?
Mr. Chairman, no comment.
I'm sorry I missed that, Mike.
No comment.
Oh, all right. Dr. Mclandress, do you wish to comment?
Thanks, Mr. Chairman. Yes, I clearly echo what Jay Nelson has said. We have not reached a tipping point. It is not accurate, actually, as projected by Glenn, that our threat is gone. There's worldwide evidence that second, third, fourth surge is happening. Several countries are closed, as you know. We have variants that are proven to be more communicable and cause a higher level of morbidity, that is, a higher level of illness. And we do not know the effectiveness or efficacy of our vaccines. Next, we are now opening the vaccines to our whole population. And we do not have a community demographics of vaccination yet achieved to protect the public. And so I will recognize and acknowledge that our legislators have allowed and actually somewhat propagated the idea that our county commissioners in each separate county would have ultimate authority over a public health emergency. And I agree with Governor Little's recent letter, which fears that this legislation causes potential barriers for local public health and could impair public health ability to respond in case of a public health emergency. So I recognize that continuing this mandate puts some burden to our county commissioners. But I believe that we are not over the tipping point. There's plenty of evidence for that. So I'm not in favor of the motion.
All right, I think we've given every board member a chance to comment on the motion.
Mr. Chairman, I have not had a chance to comment on the motion.
Well, I declare, I will so do.
Let's talk about the science. The CDC recently published another study. They gathered statistics from March 1st of last year through December 31st. Looking at the effect of mask mandates in the 2,313 counties in which masks were mandated, and of the 3,142 counties in the United States. Looking at the county by county data, the CDC concluded that mask mandates were associated with an average 1.32% decrease in the growth rate of COVID-19 cases and deaths during the first 100 days after the mask policy was implemented. Bear in mind, it's entirely possible that the real figure is even lower than that, given all the questionable COVID statistics. And let's not forget, they're counting COVID cases, which, as we know, is a positive test in a PCR test, which has just had its cycle threshold changed, which is going to drop the number of cases by approximately 90%. But for example, we've seen that the flu cases in the United States during the same period have dropped from their normal large number, has dropped by 98%. How many people actually believe that number? I certainly don't. How many people believe that heart disease is no longer the #1 killer in the United States? It's now number 8, having been replaced by COVID. It doesn't make sense. And the science here is that at most we have a 1.32% decrease in cases, not illness, cases, by enacting a mask mandate. And the damage that's being done to people by wearing masks, the psychological damage, the social damage, nobody's counting that. For that reason, I urge that we rescind this silly mask mandate and let our people get back to normal lives.
Any other comments from board members?
Yes, sir, I would like to just respond to Alan. There's plenty of evidence worldwide that protecting each other with masks has reduced the incidence of influenza in the world. There, in the large view, is a large forest out there, Alan, and your look at this is looking at a few selected trees, a few selected points, which is injecting doubt into the public, and I believe it's counterproductive to public health and public safety. And so I think it's important to look at the broader picture, and that's my bottom line on your comments there. Thanks.
Okay,
Mr. Chairman,
Glenn?
Can I add something as well?
you have the floor, Glenn. I think.
okay. Dr. Mclandress, how many studies have you seen of the number of people who have died from suicide or from alcoholism or from drug use because of the masks and the other lockdowns caused by the COVID? Have we studied that?
There's no evidence that mask mandates by themselves have increased incidence of the morbidity and mortality that you just mentioned.
Bullshit. Yeah, you're not asking the right people.
Okay, thank you.
Okay. There'll be no speaking from the audience.
Oh, really?
Yes,
Not at all?
not at all, or else you could be excused. You could be
You're
excused.
not looking to pay your salaries. Oh, I got one.
Will there be any time for public input?
Okay, this is a public meeting, and at a public meeting, you are welcome to be here. You are not welcome to speak.
Okay, I just was asking.
That's not my rule, that's the way it is. Okay, and if you're not satisfied with that, I will just have to ask you to leave. Okay? Any other comments from board members on the motion? All right. Hearing no further comments, I will do a roll call vote. Remember that by this motion, a yes vote means that the document dated January 28, 2021 is rescinded in total. We're not changing words or shifting sentences or anything like that. This means a total rescinding of the January 28, 2021 document. Any questions on this motion then? All right, we'll start out. Glenn Bailey,
Aye.
I need either a yes or no vote.
Yes.
All right, thank you. Tim Bertling,
Yes.
Jay Nelson,
No?
Alan Banks,
Yes.
Dr. Mclandress,
No?
Mike, Commissioner Fitzgerald,
Yes.
and Benoit County votes yes. The document dated January 28th, as of right now, is rescinded. All right, we will move on with our agenda. The next item on our agenda is going back to this IDAPA Rule